Well, hello again. This is Robert Schein, Managing Director and Partner with Blanke Schein Wealth Management. Today is March 25th and 2020. And what I'm doing is being proactive with our clients. And as you guys can't come into the office and see me, I want to sort of, give you updates. And all of our friends and family that are out there, we ask you to stay healthy, stay safe. And we're praying for you if you have somebody that you know of that's going through this health crisis. This is the Covid19 right now. We've got more reports today that New York is needs some help. I think they're being very proactive in the sense that they're utilizing and mobilizing all of the medical health world that they can, both public and private. Private, a lot of companies that are stepping up to the plate. I think I've talked about this last week, that this is what you're going to see, the partnership, the ingenuity, sort of capitalism at its finest with American ingenuity right behind it. And you have great companies that are stepping up that, a week and a half ago, who knew that, Elon Musk and Tesla could make ventilators, and all of a sudden they're making deliveries. And you have a lot of other companies that are stepping up in following suit. And that's really what's going to get us through this. This is America. We're the best country in the world, the best place to be in the world. And now when we go through crisis like we are right now, and we're going to get through this, we're going to get through this together. So one of the things I want to talk to you about today, 4 different things specifically. Number one, with the headlines. So I just talked about the Corona-19 update, but let's talk about the math behind it, because sometimes, one of my best grades I ever received was in college, and it was my statistical analysis class. I love business. I'm a passionate, entrepreneur and business person. So you want to kind of pay attention to Business 101 or Math 101 as it relates to, remember the numerator and the denominator. So let's talk about this. So the numerator is on top. In this case, it's the coronavirus total number of deaths, and the denominator are the total number of infections. And if you recall, when this was first discussed about less than 4 weeks ago in the United States, both of those numbers have just started spiking. In fact, Governor Cuomo in New York is talking about the denominator. It's going up exponentially every day. But if you also look at the denominator as it relates to Italy, they've peaked. In fact, the last couple of 3-4 days, we're watching those headlines. The denominator I'm referring to is the total number of infected. So as that number grows, and it will continue to grow, especially here in the United States, because why? We are testing more and more. And when you test, which is important, and it's a very important health thing that we're doing, you have to test because you can't manage what you can't measure. So we have to know, one, who's infected and where, and if there's other additional pockets out there in the United States that we need to address from a health perspective. But as you do that, you're going to get another higher reading every day in the United States, much like they did in Italy, and then Korea and China in months back, okay, and weeks back. As you continue to test, you're going to continue to increase the denominator, okay? So number of infected cases. You're also going to have, as the headlines say, the number of impacted, fatalities, deaths. That's the numerator, and it continues to grow as well. What that means is, yes, we know this to be certain, is the death rate, unfortunately, will continue to rise, okay? But there's a rate of rise where at some point in time it slows down on the death rate or fatality rate, as well as you're going to get an exponential growth on the numerator. Well, what does that mean? If you take one, divide it into the other, ultimately, as the larger number, the denominator grows, and the numerator still grows, but not at a rate that is troubling, if you will, in terms of fatalities and death rate, that will eventually, at some point in time, slow down, but the number below gets larger and larger. You take one, divide it into the other, and that's your fatality rate. So originally reported 3 weeks ago, it was about a 3 to 4% worldwide, because we didn't know the number of cases infected. What we're finding out now is, as the number of infected grows, that brings down the fatality rate, which means in the United States, we're less than a 1% now, and that's going to go lower. That's getting closer, not quite as close to our regular seasonal flu, but it's not as bad as reported relative to rest of the world. Let me put it in other terms. yes, you're seeing some things that are disturbing in New York City, and they're attacking it like New Yorkers can and have done in previous crises. We've seen this before. And as they should, they take it very seriously, and they lean in, and they handle this, and they handle this as a community, and we handle this as a country together. So we can do, all of us are here to support as it relates to that. But you're also going to get that the United States, if you were to be sick, this is the place. I already discussed this in a previous point that I sent out before. This is the place to get sick, unfortunately, because our healthcare system is not a third world country. So what you get with the numbers as it relates to statistics and around the world, you have we're comparing the United States, or at least the headlines, the news is comparing the United States as it relates to the rest of the world. You can't do that. We have to take us out of that sample set and say, wait a minute, we have different healthcare. I mean, look at Italy. They have the oldest population. Okay, they have the oldest and the highest concentration of smokers. So this is a lung. This is also impacts your lungs. So if you're a smoker, this disease is going to go right for you. It's not going to help you. Plus customs, and they have centralized healthcare. Customs. So in Italy and France, they kiss cheek to cheek. Well, that's a higher transmission rate. And I don't know why no one's talking about customs. I mean, we shake hands in America, but we're not doing what France, or at least what Italy does, as a customary greeting. That's going to change going forward. Unfortunately, I've been doing that for hundreds of years and thousands of years. But that's a huge impact and component to the exponential growth. So they're doing the right thing, shutting the country down. Everyone has to stay home. That's the right decision and call in Italy, because it needs to work. And also they have centralized healthcare. Centralized healthcare in Italy, it doesn't help. I mean, here in the United States, we have sort of capitalism at its finest in the healthcare system. It's not great. It's not ideal, you know, but I could tell you one hospital is working to be better than the other hospital versus the government controlling both hospitals. So it's a very different system. So I just want to make those very clear, distinct differences as it relates to what we're seeing in the headlines, that's COVID-19, as it relates to sort of the impact in the United States. Now, I'm not saying it's not going to get worse before it gets better from a health standpoint, and it will. But we're going to do our part. We're going to stay at home, and we're going to, not socialize. So we're going to do our part so the medical community can do their part. So thanks for listening. That's first update right now, and thanks for your time today.